Good evening, Munanda. We welcome you all. We welcome you all to the International Symposium on Research and Publications of Environment, Health, Well-being and Sustainable Development 2023, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, India's G20 presidency, United Nations Sustainable Development Goals 2015 to 2030 as part of awareness and campaigns, and World Health Week and World Health Month 2023 with the theme Health for All, in collaboration with Sri Holistic Health Foundation India and Sri Research Institute Center for Art, Sciences and Wellbeing. Before we start our sessions, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
The blessings of Almighty, we shall continue with the sessions. We request everyone to quickly register, if not registered, for this international symposium. Registration link has been shared in the chat box. Today, we are looking at the concept of One Health, which is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. So it recognizes that the health of humans, domestic and wild animals, plants, and other wider environment, including ecosystems, are closely linked and interdependent. While health, food, water, energy, and environment are all wider topics with sector-specific concerns, the collaboration across sectors and disciplines contributes to protect health, address health challenges such as emergence of infectious disease, antimicrobial resistance, and food safety, and promote the health and integrity of our ecosystems. By linking human, animals, and the environment, One Health can help to address the full spectrum of disease control, from prevention to detection, preparedness, response, and management, and contribute to the global health security. So the approach can be applied at the community, subnational, national, regional, and global levels and relies on shared and effective governance, communication, collaboration, and coordination. Having the One Health approach in place makes it easier for the people for the better understanding the co-benefits, risks, trade-offs, and opportunities to advance equitable and holistic health solutions. The health of humans, animals, and ecosystems are closely interlinked. Changes in these relationships can increase the risk of new human and animal diseases developing and spreading. The close links between human, animal, and environmental health demand close collaboration, communication, and coordination between the relevant sectors. One Health is such an approach to optimize the health of humans, animals, and ecosystems by integrating these fields rather than keeping them separate. Some 60% of the emerging infectious diseases that are reported globally come from animals, both wild and domestic. Over 30 new human pathogens have been detected in the last 3 decades, 75% of which originated in animals. Human activities and stressed ecosystems have created new opportunities for the diseases to emerge and spread. These stressors include animal trade, agriculture, livestock farming, urbanization, extractive industries, climate change, habitat fragmentation, and encroachment into wild areas and consumption of meat and meat products. One Health approach uses the close interdependent links among these fields to create new surveillance and disease control methods. For example, the way land is used can impact the number of malarial cases, weather patterns, and human-built water controls can affect diseases like dengue. Trade in live wild animals can increase the likelihood of infectious diseases jumping over to the people called disease spillover. The COVID-19 pandemic put a spotlight on the need for a global framework for improved surveillance and a more holistic, integrated system. Gaps in One Health, knowledge prevention, and integrated approaches were seen as a key drivers of the pandemic. By addressing the linkages between human, animal, and environmental health, One Health is seen as a transformative approach to improve global health. So, the emergence of the SARS-CoV-2 virus that has caused COVID-19 has underlined the need to strengthen the One Health approach with a greater emphasis on connections to animal health and the environment. Attempting to save money by neglecting environmental protection, emergency preparedness, health systems, water and sanitation infrastructure, and social safety nets have proven to be false economy. And the bill is now being paid by many times over by everyone across the world. Surveillance that monitors risks and helps identify patterns across these many areas is needed. In addition, new research should integrate the impact of different fields, particularly on drivers that lead to crisis. To implement One Health, many structural changes are required to integrate the human, animal, and environmental health fields and support multi-sectorial communication, collaboration, coordination, and capacity strengthening. Critical gaps in One Health implementation include databases and resources to support information sharing and action in line with One Health approach, identification and showcasing of best practice examples for One Health implementation, mapping of existing initiatives and capacities for One Health research, and building the next generation One Health workforce, a model for an integrated One Health surveillance system, mechanism for routine and emergency coordination with relevant stakeholders, a more complete understanding of the drivers of the spillover of zoonotic diseases transmitted between animals and humans. This includes animal trade, agriculture, livestock farming, urbanization, and habitat fragmentation. A standard approach for assessing risks of spillover of pathogens between different animal populations and humans, and emergence of zoonotic diseases, including those arising in food systems, and methods for identifying and reducing spillover risks and spread of zoonotic diseases in ways that minimize trade-offs and maximize co-benefits with other health and sustainable development objectives. World Health Organization is integrating One Health across its units and offices, providing strategic advice relating to the policy and conducting training at the local, national, and regional levels. The goal is stronger programs that are led and owned by countries. World Health Organization is a member of One Health quadripartite with the Food and Agriculture Organization, the World Organization for Animal Health, and the United Nations Environment Program. Together, they have developed a One Health and joint plan of action that includes a set of activities that the four organizations can do together, including working with political leaders to establish the need, infrastructure, and funding. World Health Organization is the secretariat for One Health high-level expert panel, which provides scientific advice to the quadripartite partners on One Health priority, setting policies and strategies. This includes recommendations on good practices, a model of One Health surveillance system, a comprehensive list of upstream drivers of zoonotic disease spillover, and recommendations to mitigate these risks. One Health is an approach that recognizes that the health of the people is closely connected to the health of the animals and our shared environment. So, One Health is not new, but it has become more important in recent years. This is because many factors have changed interactions between people, animals, plants, and our environment. Human populations are growing and expanding into new geographical areas. As a result, more people live in close contact with wild and domestic animals, both livestock and pets. Animals play an important role in our lives, whether food, fiber, livelihoods, travel, sport, education, or companionship. Close contact with animals and their environments provides more opportunities for diseases to pass between animals and people. The earth has experienced changes in climate and land use, such as deforestation and intensive farming practices, disruptions in environmental conditions, and habitats that can provide more opportunities. For diseases to pass to animals. The movement of people, animals, and animal products has increased from international travel and trade. As a result, diseases can spread quickly across borders and around the globe. These changes have led to spread of existing or known endemic and new or emerging zoonotic diseases, which are diseases that can spread between animals and people. Every year, millions of people and animals around the world are affected by zoonotic diseases. So, zoonotic diseases include like rabies, salmonella infection, West Nile virus infection, Q fever, anthrax, brucellosis, Lyme disease, ringworm, Ebola. All are these examples of zoonotic diseases. Even recent COVID-19 is also said to be one of such diseases. Animals also share our susceptibility to some diseases and environmental hazards. Because of this, they can sometimes serve as early warning signs of potential human illness. For example, birds often die of West Nile virus before people in the same area get sick with the West Nile virus infection. So, thus, One Health is an important strategy and concept to be considered. It includes emerging, re-emerging, and endemic zoonotic diseases, neglected tropical diseases, vector-borne diseases, antimicrobial resistance, food safety and food security, environmental contamination, climate change, and other health threats shared by people, animals, and the environment. For example, antimicrobial resistant germs can quickly spread through communities. The food supply, healthcare facilities, and the environment, soil, water, making it harder to treat certain infections in animals and people. Vector-borne diseases are on the rise with warmer temperatures and expanded mosquito and tick habitats. Disease in food and animals can threaten supplies, livelihoods, and economies. The human and animal bond can help improve mental well-being. Contamination of water used for drinking, recreation, and more can make people and animals sick. Even the field of chronic diseases, mental health, injury, occupational health, and non-communicable diseases can benefit from a One Health approach involving collaboration across disciplines and sectors. So One Health is gaining recognition in US and also globally across the world as an effective way to fight health issues at the human-animal-environment interface, including zoonotic diseases. One Health approach involves experts in human, animal, environmental health, and other relevant disciplines and sectors in monitoring and controlling public health threats, and to learn about these diseases and how diseases spread among people, animals, plants, and the environment. Successful public health interventions require the cooperation of human, animal, and environmental health partners, professionals in human health, doctors, nurses, public health practitioners, epidemiologists, animal health veterans, paraprofessionals, agriculture workers, environment ecologists, wildlife experts, and other areas of expertise need to communicate, collaborate on, and coordinate activities. Other relevant players in One Health approach could include law enforcement, policymakers, agriculture communities, and even pet owners. No one person, organization, or sector can address issues at the animal human environment interface alone. The One Health approach can prevent outbreaks of zoonotic diseases in animals and people, improve food safety and security, reduce antimicrobial resistant infections, and improve human and animal health, protect global health security, protect biodiversity and conservation. By promoting collaboration across all sectors, a One Health approach can achieve the best health outcomes for people, animals, and plants in a shared environment. COVID-19 has led to the loss of millions of lives and trillions of dollars from the global economy, an impact that needs to be avoided in the future. The emergence of SARS-CoV-2 virus has underlined the need to strengthen the One Health approach with a greater emphasis on the connections to the environment, as well as the promoting a healthy and green recovery from COVID-19, as described in the World Health Organization Manifesto for a Healthy Recovery from COVID-19. Human health is a pillar of global health security that is sustained directly and indirectly through access to the clean air and fresh air, safe food and healthy sustainable diets, and the availability of and access to medicines. As we come together as a community in the aftermath of global pandemic, we have an unprecedented opportunity to strengthen cross-sectoral collaboration, increase policy coordination and coherence supported by more systematic use of robust scientific evidence, and promote the development of integrated indicators and safeguards to address upstream drivers of disease with a focus of prevention. These efforts will not only contribute to the prevention of future pandemics, but will help to build more resilient and equitable systems, environments, economies, and societies. One Health is a collaborative, multi-sectorial and transdisciplinary approach, working at the local, regional, national, and global levels with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environments. The One Health approach summarizes a concept that has been known for more than a century, that human, animal, and plant health are interdependent and bound to the health of the ecosystem in which they exist. We envisage and implement it as a collaborative whole of the society, whole of the government approach to understanding, anticipating, and addressing risks to global health. Even before even before the emergence of human beings, we have the concept of Vasudhaiva Kutumbakam, means one world, one family. The entire planet belongs to everyone, and we all belong to one family, including human beings, animals, plants, and other species. So that's why this concept is not new to us, but it has been said long back. It is since years ago, centuries ago. So today, this concept of Vasudhaiva Kutumbakam, that is one world, one family, including all the living beings and non-living beings, is the need of the hour to save not only ours, but also all the species on the planet. Otherwise, we need to understand, we need to acknowledge, and we need to be aware consciously that before human beings, this world has existed and many species existed. And even after human beings, because the serious threat that is going to pose in coming years is majorly for human beings. So if the same continues, soon the human race is going to become extinct and the world is going to live as it is, even without humans, as it existed earlier. So we human beings have the highest priority now, and also we need to take commitment towards protection, conservation, and promotion of environment health, plant health, animal health that contributes to the human health. Otherwise, it can pose a greater risk to the human health and well-being, and also can seriously affect the economy as well. As the COVID-19 has given us a great lesson, where a human public health crisis resulting from a virus of potential animal origin. This is a classical example of recent origin we are still facing today and struggling today. If we don't take care of our nature, our animals, our plants, then these pandemics are going to be a routine in the future. And it also underlines the validity of One Health concept in understanding and confronting global health risks, often used to coordinate multi-sectorial prevention, preparedness, and response efforts of zoonotic diseases, those that may transit from animals to humans or humans to animals. This approach is critical for the control of priority zoonotic diseases such as rabies, avian flu, or viral hemorrhage fevers such as Ebola. Furthermore, numerous cross-cutting issues such as antimicrobial resistance, food safety, climate change, and weak health care infrastructure needs to be addressed from a multi-sectorial and multidisciplinary perspective, which the One Health approach guarantees. Health risks are increasing. Drivers such as changes in climate and land use, unsustainable agricultural practices, globalization, and the wildlife trade provide multiple opportunities for pathogens to evolve into new forms, making spillover events from animals to humans more frequent and intense. And the risk is not only for humans. While most risk assessments focus on transmission of pathogens from animals to humans, diseases can also pass from humans to animals and generate great impacts on the health of animals, whether domestic or wild. COVID-19, tuberculosis, influenza, among others, can infect or to be fatal to different species of animals, gorillas, and chimpanzees, with their close genetic makeup to humans, are particularly susceptible to human diseases. Similarly, to other endangered species, they should be handled with care by veterinary services, wildlife authorities, and researchers. Managing these major global health risks is not possible alone. It requires the full cooperation of the animal, human, planet, plant, and environmental health sectors. The World Organization for Animal Health, founded as OIE, brings its expertise in animal health and welfare to the much needed multi-sectoral partnerships. Together, we aim to develop global strategies to tackling major diseases or broader health threats such as antimicrobial resistance. Throughout the organization's work, we promote the One Health approach, recognizing the interdependence of animal, human, and environmental health, because the health of the animals and of the environment strongly depend on human activities, and our relationship with nature, because the health of animals and environment also determine human health. It's everyone's health. Together, we can find concrete solutions from a healthier and more sustainable world, as quoted by Dr. Monty Elliott, Director General of the World Organization for Animal Health.
Meet Musa. Musa is a veterinarian. With other animal health professionals, he helps fight animal diseases and improve animal welfare. You know that in doing also helps keep you and your family healthy. The far-reaching impacts of Musa's work should not come as a surprise. In our globalized world, we are all interdependent. Animal diseases can affect the health of people, and human diseases can affect the health of animals. For example, when humans cut down trees, they affect the balance of the ecosystem and of all the creatures living in it. Usual ecosystem services such as food provision or carbon capture can become a challenge. Wild animals are sometimes forced to flee their natural habitats to find sources of food getting closer to villages. Animals and humans that should never have interacted so closely suddenly do. And dangerous pathogens can jump from one species to the next. Sound familiar? Around 5 new human diseases appear every year. 3 of them are of animal origin, as for example Ebola and most probably COVID-19. 60% of existing human infectious diseases come from animals. Deforestation is just one example. Unregulated wildlife trade, climate change, all affect environmental health and with it, animals and humans. Musa and his colleagues are at the forefront of the fight against diseases that can affect the health of all. To create a healthier world, they need to work in collaboration with other sectors. The World Organization for Animal Health helps them come together with other experts to share essential knowledge, to build a global network, and to design a common response to global threats. Because we all share one world, we all share one health.
Whether we have 2, 4, or even 0 legs, we're all part of the same planet and are all connected to one another and our environment, especially when it comes to our health. This relationship is so strong, there's a name for it. One Health. Infectious diseases such as rabies are an example of the One Health concept in action. 24 people in India, many of which are children, will die each day as a result of a rabid dog bite. And many dogs have been killed in attempts to prevent spread of the disease. But there is a better way. Vaccinating dogs against rabies reduces rates of the disease in people, meaning the dogs and people of India can live safely together. The One Health concept extends to our food too. Take milk, for example. The World Health Organization recommends each person gets about 2 glasses of milk every day. As our population continues to increase, keeping up with this global demand for milk is becoming more and more difficult. One solution would be to get more cows. But space and resources are limited. But there is a better way. If each cow produced just over half a glass more milk each day, it would be enough to meet our growing need. Healthy cows produce more milk, so increased efforts to keep cows free from disease is one way to achieve this. One Health is also helping researchers find a better way to treat and prevent certain forms of cancer in both animals and people. Using advanced techniques, a type of vaccine has been developed to help treat dogs that have a type of cancer called melanoma. There is hope that the same technique can be developed for human use, with several products currently in trial. One Health is in action all around the world. And every day, veterinary medicines are doing more than just keeping our animals healthy. Because healthier animals mean a healthier world.
One Health requires a multi
One Health refers to the area of overlap between human health, animal health, and environmental health. And a lot of the problems that we face today are really complex, and they involve ecological issues as well as what's happening with wildlife, with livestock, with human health. And so One Health really seeks to address all of those simultaneously to better answer those problems. Take the pandemic we're facing right now as an example. COVID-19 is a zoonotic disease with an origin in bat populations in China. And to really prevent diseases like this, we have to understand the ecology of the wildlife reservoir, of the bats in this case. We have to understand the ecology of how people and these animals interact. How does the virus get from the wildlife into people? And then once it gets into humans, how does it spread between people and other people? How does it spread back to wildlife? How do we understand that transmission, and what effect does that have on the future of this and other pandemics? The One Health approach allows us to tackle problems that are practical problems, applied problems. If we take Arizona as an example, we sit here on the border between the United States and Mexico. We sit in an area that is an arid landscape. We sit in an area that has a lot of productive agriculture, yet has a lot of pollution problems. We can better understand how to tackle climate change, how to deal with droughts, how to deal with fires increasing. We can look at health in a border community. We can understand better how to promote the health of vulnerable populations. All of these things, disease surveillance, looking at stopping diseases before they become of a pandemic scale. These are the kinds of things where there's practical importance to a One Health approach. It's an exciting time to be in the area of One Health because it's a time when we're able to take people who are in the biomedical sciences and agricultural sciences, even as far afield as computer science, psychology, and law, to address these major issues that we're facing today.
Our planet's forests are some of the most valuable resources we have. They provide us with clean air, a source of food, construction material, and much more. Even more importantly, forests are a major line of defense against climate change. A single tree can absorb as much as 48 pounds of carbon dioxide from the atmosphere each year, which makes them the most effective CO2 scrubbing machines we have. Despite this, forests are being systematically eliminated all across the world. A process we know as deforestation. Each year, 15 billion trees are lost to deforestation and forest degradation. That's 36 football fields worth of trees a minute, and accelerating. At this rate, the world's rainforests may be completely gone within 100 years. This makes deforestation responsible for around 13% of the world's carbon emissions, making it a major driver of climate change. Not only do we need trees to absorb our carbon, when they're removed, much of the carbon they had stored is released. Agriculture is responsible for the vast majority
Friends, quickly fill up the feedback form, which has been raised in the form of polls.